Did you know that in the United States, despite being one of the world's leading powers, millions of people face barriers to accessing basic healthcare services? This doesn't just affect those who lack financial means, it also worsens health problems across entire communities. Today, we're going to talk about one of the country's biggest challenges: inequality in access to healthcare. Why is the American healthcare system far from being universal? And what are the consequences for the population? Don't miss this important discussion that could transform your perspective on the topic. Comment now. Health is a right for everyone, to show that you believe in the importance of an accessible healthcare system for all. Today, we're diving into a topic that will make you reflect deeply on inequality and social justice. Are you ready to understand why access to healthcare is still a privilege in the US and how this impacts millions of people? Stick with me to find out. When we talk about the United States, the image that comes to mind for many is that of a developed country with advanced technology and a high quality of life. But what most people don't realize is that behind this facade of prosperity lies a deep inequality in access to healthcare. Unlike countries with universal healthcare systems, such as Canada or the United Kingdom, the US operates on a model based on private insurance and limited public programs like Medicare and Medicaid. The problem? Not everyone qualifies for these programs, and many can't afford private health insurance. Imagine this: approximately 27.5 million Americans were uninsured in 2022. That means these individuals face enormous barriers to something as basic as medical consultations, medications, exams, or even emergency care. For those living in impoverished areas or who are part of racial minorities, the situation is even worse. Studies show that African American and Latino communities experience a disproportionate rate of chronic illnesses like diabetes and hypertension, precisely due to a lack of access to preventive care. Did you know, for example, that the average cost of a hospital stay in the US can exceed $10,000? This amount is unthinkable for millions of families, forcing many to choose between paying bills or taking care of their health. This reality perpetuates a dangerous cycle. The longer someone delays treatment, the worse their health problems become, and it doesn't stop there. The absence of a universal system not only affects individuals, but also overburdens public hospitals and increases overall system costs. When people only seek care in emergencies, treatments become more expensive and less effective. But why hasn't the US, one of the largest economies in the world, implemented a universal healthcare system? There are historical, political, and economic reasons for this. And that's exactly what we're going to explore in depth. Stay with me until the end, because I'll show you how inequality in healthcare access affects even those with insurance and highlight some initiatives working to change this reality. To understand why healthcare inequality runs so deep in the US, we need to examine the roots of the issue. Unlike countries that see healthcare as a universal right, the United States has historically treated it as a commodity. This means that those with money or good insurance have access to the best services, while those without are often left behind. How does this play out in practice? Let's break it down into 3 critical points that illustrate the impact of this inequality. 1. Economic disparity. In the US, private health insurance is expensive. On average, a family health plan can cost over $22,000 per year. While many employers offer insurance as a benefit, not all can afford it, especially small businesses. This leaves millions of workers unprotected. Even those with insurance face challenges. So-called high-deductible health plans have lower premiums, but require patients to pay significant out-of-pocket costs before coverage kicks in. This discourages many from visiting the doctor, fearing high expenses. 2. Racial and social impact. Healthcare inequality is particularly severe among racial minorities. Studies show that African Americans and Latinos have less access to preventive care and are more likely to suffer from chronic conditions such as diabetes, obesity, and cardiovascular disease. These disparities are the result of decades of systemic racism, which have relegated entire communities to poor living conditions with limited access to healthy food, safe spaces for exercise, and quality medical care. 3. Healthcare system fragmentation. The US. Healthcare system is a patchwork of public and private initiatives that often don't work well together. Medicare serves the elderly, Medicaid serves low-income populations, But many people fall into the gap, earning too much to qualify for public programs, but not enough to afford private insurance. This reliance on private insurance creates a paradox. While some hospitals and clinics offer cutting-edge services, others face underfunding, particularly in rural and underserved areas. This creates so-called medical deserts, where access to care is extremely limited. And what happens to those without insurance? Uninsured individuals often rely on public hospitals or NGOs for care. However, these resources are insufficient to meet demand. The lack of preventive care also means many illnesses are diagnosed too late, when treatment is more expensive and less effective. For example, cancer that could be successfully treated in its early stages is frequently diagnosed in advanced stages among vulnerable populations. The result? Higher mortality rates and astronomical costs for the healthcare system. Conclusion and reflection. Reforming the healthcare system isn't just about helping the poor. It's about creating a fairer society where everyone has the opportunity to live a healthy and fulfilling life. If you made it this far, congratulations. You're someone committed to knowledge and change. Comment now. I believe healthcare is a right, not a privilege, to show that you're part of this transformation. And before you go, check out the list of 100% natural products we've curated for you. These can make a big difference in your health and well-being. The link is in the video description. Thank you for staying until the end. See you in the next video.